Okay, are we close enough to 110? You guys want to start? What do you think? All right. So I'm John Stivers. I'm first year medical resident, surgical resident over at UCSF Fresno. I'm actually post-call right now. I'm really sleepy. I've had 2 hours of sleep in like the last 30 hours. So if I say medicine instead of surgery or make various other strange mistakes, that's why. Anyway, so this is kind of a half-dashed presentation I put together in the last 2 hours, hopefully. If there's anything missing, I apologize. We'll fill in as we go along. If you guys have any questions at all throughout the whole process, let me know, okay? So you want to be a surgeon. It's actually, it's a book, pamphlet, I guess, that was published by the American College of Surgeons, like the last ever in a year. That's usually available, but they've actually stopped printing these. So you can actually get it online, basically. You can go to the American College of Surgeons website, ACS website, and you guys come in. Keep it casual, just come in. ACS to the website if you guys are interested in surgery at all, if you want to like just get their suggestions about the kind of things to look at if you're considering surgery. It's a good resource. And at least part of this is plagiarized from them. So let's see. So how to get from point A to point B, high school all the way up until surgery and beyond. Like a lot of you guys who are interested in medicine, you've probably done some volunteering activities. High school, college, you'll find yourself here-ish. And, you know, getting a lot of important responsibilities like fetching water or like showing volunteers or showing family members how to get in and out of the hospital successfully. Not a lot of responsibility there. You know, so sorry, I should preface this. We'll just go over the nuts and bolts of how to get to surgery. Okay, so you'll do your volunteering, and et cetera. Of course, nothing really gives you responsibility. It looks really good on a resume until you're actually paid to do it. So, you know, through high school, not so much going on. Once you're in college, of course, I'd highly suggest you do something like being an EMT, doing research, something that gets you actually clinically involved, that actually looks good on a resume, versus volunteering, where once again, there's much responsibility there. So consider that. Eventually, you'll finish up college, you'll apply to medical school, you'll write personal statements. And I thought that having this talk was great. It was a chance for me to re-examine my personal statement, because at every level of your training, you end up having to write a personal statement. And inevitably the question is, why do you want to be a surgeon? And, you know, in high school, into college, and then your med school application, then your residency application, you know, hopefully it progresses. You know, at the beginning, you're like, well, I thought, you know, surgery looked like fun. And then, you know, at the end of medical school, hopefully you can say, I've had experience and it sounds like it's actually fun. Like I've actually had some exposure to it. And so you'll look back on your personal statements, I did, and you're going to see this progression of this idea that you have of being a surgeon, and then you get the exposure along the way. It's going to test you as whether or not you really want to do that. And honestly, having this talk was a nice way for me to reflect on that. So you're going to apply to medical school. You're going to write that personal statement. Don't fall trapped to the idea that you have to say that you went on a medical mission and, like, you know, along the way from the airport, your van broke down and like some locals picked you up and drove you into the village. And at the end of the day, you learn more about yourself than about, you know, anything else, medicine or otherwise. They've heard that one so many times. You don't even do yourself a favor. Don't even put that into your personal statement. So you'll do medical school. And does anybody know what match day is? Okay. Anybody know when match day was for this year? Yeah, exactly. So 9 o'clock. I believe it's 9 o'clock Western time. All these people found out where they were going for the next 4, 5 years if you're a surgeon. And here's me match day last year, and there's me, you know, putting a pin on the map, going to Fresno. I think I was wearing the same suit actually. Done a lot of variety in my suits. Anyway, so you'll finish at medical school and you go on to residency. You know, if you're doing surgery, you'll strap on the gown and, you know, actually get your hands dirty, like properly dirty for the first time. Whereas in medical school, you had to kind of fight to get to the front and actually get your hands into there. In residency, it's the expectation that you're actually getting your hands dirty. If you're not doing so, then you're not getting the training that you need, because you only have 5 years. You know, unless you severely mess up as far as your training is concerned, and they keep you an additional year. And so you need to get as much exposure as humanly possible. So, like I was saying, yeah, you get progressive responsibility. In medical school, you're kind of working on the dummies and, you know, putting on the short white coat and, you know, are generally kind of the bottom of the totem pole. And then in residency, you know, a little more responsibility. And then eventually you're going to finish up residency. You're going to go on to fellowship. Now, fellowship is becoming more and more a requirement as the portions of surgery get divvied up and people spend more and more time practicing those things. So you as a general surgeon, although you would be perfectly capable of doing most of the plastic surgical and a lot of the OB-GYN type surgeries, because everyone's so specialized now, you oftentimes find yourself parting those surgeries out to the various subspecialties. And this is pretty complete as far as subspecialties that you should consider. I list things like OB-GYN, for example, even though they're not a subspecialty of surgery specifically, wherein you would start out in general surgery and then progress into OB-GYN. It's certainly considered a surgical subspecialty because the gynecologic portion is heavily surgical. You do spend half your time in training there in the OR practicing GYN surge, but then the other half of that's OB. And that's one of the things about, for example, OB that could be attractive is that you have a portion that's obstetrics, that you're having clinical patients that you see on a regular basis that you have a relationship with, versus general surgeons who, quite frankly, would rather avoid having long-term relationships with any of these patients. You have long-term relationships. It's more of along the lines of, oh, you're in my OR now because you're shot, and then a year later you come back and oh, you're shot again. So you have this continuation. And you get to see the old scars and the bullet that you didn't take out last year. So that's the general surgeon's idea of a continued clinical experience. But there's these other specialties too, all of which have varying degrees of technical or intellectual challenge versus how much of a clinical relationship you're going to have with the patient in a longitudinal sense. Neurosurgery, you can imagine, not so much of that. They're kind of like trauma surgeons. They deal with a lot of acute processes and the occasional cancer that they have to remove. OB, we already talked about. Ophthalmology is a direct track. You wouldn't go to general surgery for this one. It's its own dedicated track now. ENT, similar. Plastics, there's a few dedicated tracks for that one as well. And these are all things that you just have to get exposure to either in residency or during surgery in your general surgery years and decide that you want to subspecialize into that. For me personally, I really want to go into trauma surgery, but that's because of the very kind of backward direction I took to get where I am now. So, but we'll touch on that shortly. So why do surgery? So here's where I get to plagiarize the American College of Surgeons. They ask, do you like working in a team? Do you enjoy watching procedures? Do you embrace responsibility? Do you want to make a positive impact? These very vague, like, well, if you want to be a surgeon, maybe these are things that you've thought to yourself. Do you find the excitement of having a great case that requires lots of preparation for? It's going to be really difficult. And these kind of all strike at a very central idea of what you as a surgeon are into, what's your focus. Whereas medicine is oftentimes concerned with the chronic management of a health problem. You as a surgeon, your whole point is, how can I get you healed? How can I get you from, take the disease, take out the gallbladder, the appendix, how can I relieve the bleeding? If somebody consults me in the ED about an infection, if there's nothing there for me to tap, there's nothing for me to do as a surgeon, and it's honestly, frankly, a waste of my time. Because you as a surgeon, you want that gratification. You want to cut into the boil, abscess, relieve the infection, and then offer this patient a cure versus, and I hate to bash on other services, but you sometimes find yourself doing so. In a medicine sense, you would be offering them antibiotics, which will hopefully get controlled, but doesn't necessarily. And in the case where an infection is something that you can't clear up with antibiotics, that's when surgeons need to be called. You are, in effect, the end of the line. I often tell this to patients who are happy to see me. They're like, oh, you're the surgeon. They're smiling. They want to shake your hand. Be like, no, you don't want to meet me. No, you don't want to be glad I'm here. I'm here because everything has failed up until this point. We tried medical management. We tried lifestyle stuff, and you're not getting better. This is not something that can be solved without a truly invasive procedure. And having the ability to give somebody that invasive procedure and everything that goes with that is kind of why it's great to be a surgeon, why you as a person, if that's something you want to do with your life, why you should consider surgery. But we'll get into that more again. So my journey, really haphazard. Let's see, I didn't get to go to college directly. I didn't have any money. So I joined the Marine Corps. I did 4 years. I went to Iraq now. That was a great time. really test your desire to do medicine. You know, I honestly wanted to heal people. I wanted to do surgery and, you know, make people better, even at an early age when I was like 18, 16-ish. And instead, I found myself doing the Marine Corps thing where instead of plugging holes, you create them a lot. So, and that's where my, right, where'd I go? Yeah, I think that's me right there. You can't see very well. Anyway, that's us in Tikrit, one of the palaces up there, that ton of palaces in Tikrit. But eventually I got out. I survived the war, right? And went on to college. That's me graduating. Mom's so proud. And a lot of people, you know, when they get to the end of college, they realize, well, I can apply now, or maybe I can take a year to buffer my resume. And that's something I decided to do for myself. I worked for a year as an EMT, and then eventually went on to medical school and graduated here last year. And, you know, that goes once again to thinking about where you're trying to get to. If you're trying to be a surgeon, if you're trying to get into medical school, starting early, doing things that really look good on your resume, getting the experience that you can point to and say, yeah, I've been exposed to medicine and I'm serious about this. Because, you know, medical schools are going to consider that maybe you're just some naive person who thinks that they'd like to do medicine, but never done more than, like, you know, been in a hospital visiting your mom. If you put in your personal statement, the reason I want to be medicine is because I had this one experience of medicine where, like, my grandma died, they're going to say, well, lots of people have grandmas that die. You know, what sets you apart? What says that you have tested this desire and proven to me and to yourself that this is something you want to dedicate yourself to? Because it is a really long journey. It is really demanding. And there's a lot of cost that goes along with it, both monetary and personal. So this is something you definitely want to consider before you dive into it. Now, what is your image of surgeons? Of course, it's all inspired by popular imagery. I personally grew up with Scrubs, Turk, and, you know, Ted, you know, Todd, high-fiving each other. Do you guys actually watch Scrubs anymore? Thank God. All right, so good. It is universally agreed upon that Scrubs is the more accurate version of what medicine's like. No offense to Grays, McDreamy, etc. I'm sure people do hook up in the call room. Haven't done it, but anyway, but like Scrubs is so accurate. It's so right on. You do have a lot of the archetypal personalities, and the surgeons, they get them pretty well on. Yeah, they can be fairly meatheadish at times. The medicine doctors can be very esoteric at times as well. But it's the dark humor, it's the laughing in the face of failure and trying to just get through your day despite everything that you see around you. Sometimes that's really accurate. And then of course you have other stuff. Dr. Oz, he's a cardiothoracic surgeon who gives you advice all the time about anything but cardiothoracic surgery. I think like 40% of things he says is correct when they've researched him. Anyway. But there's also a more classic imagery of surgery, which is actually where a lot of this is drawn upon. When you think of surgeons, maybe you think of the classic angry surgeon, you know, very despotic, focused, very clinically sterile kind of personality. And that was kind of partially inspired by William Halsted, the gentleman there on the left, father of the residency, both medicine and surgery, father of the aseptic technique. He's the first guy who said, and will actually put into place the idea of, you know, surgical gowns. You know, these over here in the what's it called, Agnew's Clinic at University of Pennsylvania. You can see everyone is, you know, sterilely dressed, and this is an operative arena. This is showing to all these people what surgery is. And surgery, even back then, has always carried this mystique of, you know, it's a very variegated area. It's very difficult to get into, and it only takes the most dedicated people, the most serious applicants. And, you know, partially we're looking for that Halstedian personality. Halsted, you know, always the extremist. He was the man who gave birth to the radical mastectomy, and people after that kept thinking, oh, the ultra radical mastectomy. How much more skin can we take? How much more muscle or bone in order to extirpate this cancer of the breast? You know, this is a time when, you know, breast cancer was considered to be fatal, and here's a man who was trying to get a cure, and it was always by that extra step. Just like his personality, he was addicted to cocaine, and like through experimentation, this back when cocaine was just being used as local anesthetic, and, you know, just by personality alone was able to overcome so much, and was just such a focused gentleman. As his effects on surgery, you know, centuries later, is still heavily felt. Other classic images, my favorite surgeon, John Hunter, anatomist. A lot of the famous surgeons started out as anatomists and continued on to actually working on live humans. And this is a time of, these images come from a time when surgeons were really famous for amputations. That was their job. They were to remove limbs. This one here, called the clinic. This one is, note it's like 14 years prior to Halstead's effect, and they're all in their, suits and frock coats, and they're doing surgery like this. Once again, with the amphitheater full of people just watching. You actually pay coming off the street just to watch amputations. And we have the soon-to-be widow in the background weeping, of course, and the gentleman here is having his leg amputated for osteomyelitis. And that was the job of the surgeon. They were supposed to be able to get off a leg quickly. During the Civil War, your technical skill as a surgeon was measured by your ability to get the limb off, and you could do it in less than a minute, They had specifically like a sickle, like a circular type sickle scalpel that could just draw around very quickly. Sometimes accidentally catching your assistant's hands in the process. Actually, the most famous, highest mortality surgery in history was by a gentleman who was doing an amputation, managed to take off the fingers of his assistant in the process. The patient died, of course, sepsis. The assistant died from sepsis of his fingers. And then there was somebody in the crowd up here who fainted, passed out, and hit their head, and then died also. So that was the first 300% mortality rate for a single surgery. I don't think it's been repeated, but who knows. So why be a surgeon? Well, I have my own personal feelings about it, but I thought it was useful maybe to ask other surgeons. So I kind of interviewed around, and it seems like it was kind of a bimodal distribution. Both there were people who felt they were called to surgery from a very early basis, like myself, and then there were people who were kind of came to it later on in life, towards the end of medical school. And there's a few very specific things about surgery that really attract people. As you can imagine, it's very technically oriented. You have to have hands. You have to be calm in the face of danger. You have to be stalwart, but you have to be humble at the same time. You have to be very dedicated to this principle of surgery, because the people that you are working on are counting on you. You see them in a very intimate setting. You get really comfortable talking about their bowel movements. I wake up people at 3 in the morning all the time and ask them if they pooped. Like, who gets to do that? But then so they invite you in, they let you, I've consented people all the time to take the operating room to unseam them from their native chaps, open their abdomen, and be in a place where no one else has been, or hopefully no one ever will be, unless we really messed up sometimes. And it's a very personal opportunity that they've offered to you, if you think about it. And yeah, you have to be very technically proficient. It's very satisfying because, yeah, like I said, you've removed the disease, you're holding it in your hand, you have the infection-ridden appendix in your hand now, and the patient's going to get better versus, almost certain death afterwards, something which no amount of antibiotics or goodwill is ever going to solve. So you have that power, you have that ability, What was the classic joke? What's the difference between surgeon and God? God doesn't think he's a surgeon, It's I don't believe it, but it's the classic joke. My trauma surgeon attending, she was impressed by the fact that every day she could find herself in a different part of the body, and it's true. The bullets go everywhere. You'll find yourself, just last night, we had somebody came in with a car crash and we were in the chest, just like that. They coded in the ED, and we ended up having to do a thoracotomy right then and there, and just holding the heart, trying to keep things going, It's just, you find yourself, gunshots to the abdomen here in Fresno, happens all the time. Yeah, we had a stab wound last night too. We were in the abdomen once more, just, you have to be there, One of my friends, her father was a surgeon. She was pretty much born into it. Another one of my friends, her father was a surgeon. She did not want anything to do with surgery, She had seen the lifestyle, she had seen the sacrifices, she'd seen her own parents' marriage dissolve as a result of surgery, and she didn't want that for herself. One of my friends, actually, when I got into surgery, told me, you in surgery, you marry your job and you cheat on it with your wife. And to an extent, that's true. But that's also kind of an old style way of looking at surgery. People in surgery back in the 80s, 90s, they would sacrifice their personal life on purpose, I feel like. But currently, the way surgery is going now, people are actually more emphasizing on personal life. People are able to get schedules that allow them to be home with their family more often. So I feel like that's at least partially ameliorated. But for some people, for a lot of surgeons, working 80 hours, 120 hours a week is very standard. Okay, and if you find yourself able to do that, if you're interested in that kind of commitment, then yeah, you can certainly step up potentially. In residency, yeah, you will definitely do between 70 and 80 hours a week as standard, you know. And you can never complain about being tired, by the way. Like, no surgeon wants to hear that you're tired because they are more tired than you. It's yeah, kind of annoying. Let's see. And then, of course, my friend who couldn't make up his mind until last year, but then he fell in love with it. I was anticipating somebody to say for, you know, money and the chicks, but, you know, nobody admitted to it. But I'm sure somebody thought, you know, at least thought it. So more on the reality of surgery and other reasons why I love surgery. One of the more classic books in surgery is Forgive and Remember. It's a book by a sociologist, PhD, who was embedded into, I believe, UCSF. He doesn't admit to it, but I think it was UCSF. Into the surgical program there back in the 70s, back when it was actually even more surgery than it is now. Actually, it was in the 80s. Anyway, and he made very poignant observations about surgery, one of which, let's see, he talked about putting on the hair shirt. If you guys are familiar with the concept of the M&M, you know, morbidity and mortality, you stand in front of a crowd of people kind of like this. You discuss your failings, you discuss what you should have done, what you could have done, and then what you're going to do in the future, so as not to do that again. And you kind of wear that shame for a while. Because that's the obligation to your patients. And that's one of the things I put out in this book, is in medicine, if you mess up, people say, well, what happened? You know, your patient was a victim to their own disease process, and you were merely trying to stop it, but you were unsuccessful. But in surgery, we say, what did you do? Because the complications that happen are often results of what you did. You know, the patient, maybe they're getting worse, fine. But for example, I had a guy, I put in a tube into his intestines the other day, and his white blood cells cracked up after that, and his temperature went up, and his abdomen was tender, and I knew that I was the guy that had potentially did that to him. I had that fear, you know, it's like my first real major complication I was really worried about. But then it came back down, thankfully. He actually got all better afterwards. People oftentimes after surgery will have a transient increase in white blood cells and their fever and pain, et cetera, which will thankfully for him resolve. And then later on, his abdomen filled up with air, and I was actually worried once again. But it turned out it was the disease process that was killing him that way. But you own that complication, basically. You own this surgery, this patient, you know. Like I said, you see them come back sometimes. You'll do a surgery on somebody and you'll see them a year later, and it could be a complication of something that you did. But you own that patient now. You own that complication, everything that follows thereafter. So it's a very intimate, a very personal obligation you have to this patient. You know, something like a family practitioner, if they don't catch that hypertension, oh well, the patient's not going to know. He's hardly going to care, and maybe somebody else will take care of it. But when you take out a gallbladder and you cause them to have a bile leak that causes them to develop incredible sepsis and eventually die, or develop cancer later on in life, you own that, and you will be followed by that ghost for the rest of your life, basically. Other hardships, and I know I'm like dissuading everybody from surgery now. But you know, honestly, if you want to do surgery, none of this matters. Like, you look at the statistics and say, well, I'm better than that. And it's true. If you love what you're doing, if you love the idea of working with your hands and helping people like this, then you're not going to be afraid of the suicide rate, which is basically double the standard population, nor the depression rates, which, you know, is between 27 and 30%. Substance abuse, once again, double the average, and divorce rate, which also basically double. So surgeons